Congratulations. So you just got your braces. So this video is just to kind of refresh your memory and to give you, review the instructions that you were given the day that you got your braces on. So the first thing we obviously want to talk about is good oral hygiene. So the most important thing while your braces are on is you have to keep your teeth extremely clean. So we do recommend brushing twice a day as a minimum, morning and at night. Really better is 3 times a day, okay? So we like to add that extra brushing when you get home from school. So morning, after breakfast, when you get home from school, and then the third time is right before bed. That's really the most important one to get all that food off your teeth during the day. So brushing really should be angled towards the gum line. And for 2 minutes, you're gonna go in circles, really making sure to focus between the braces and the gums, all right? That area is where most of the food and the plaque is going to accumulate. So you really wanna make sure you do each quadrant. So 1, 2, 3, 4 are quadrants. Each quadrant should have 30 seconds of brushing, all right? So you do wanna make sure you focus on the areas by the gum line, in the areas that you chew on, and then the circles again by the gum line on the inside, on the palate side, all right? Or on the bottom, it's on the tongue side, okay? So again, angle the brush towards the gums, circles not straight across, not up and down. We wanna do circles along the gum line, the front and the back. And also you can go back and forth along the chewing surface of the teeth. And we're gonna do that in each quadrant for 30 seconds. That totals 2 minutes, okay? Now, to help you out with that, we do give you a nice old-fashioned timer, a sand timer, okay, which you can turn when you start brushing and then flip it back over when you're done, okay? So that's the brushing. All right, flossing, all right? Especially adults with braces or older teenagers, we really do want you to floss. It does become a little difficult, all right? So this is called a floss-threader, all right? Because obviously you can't floss all the way through where the wire is, okay? This is what they look like in packaging. So, you know, this is one sample here. Now, the floss-threader, all it is like a needle and thread. We bring the floss through it, okay? And then the only purpose that this serves is to get the floss underneath the wire, okay? So once the floss is underneath the wire, now you're gonna floss like normal and just go between your teeth, and then you pull it out when you're done. You wanna make sure to get up by the gum line when you floss. So proper flossing is gonna go up around one side of the gum and up around the other side of the gum. So when you go through, it doesn't just pop through. You're gonna push up, you're gonna push up on the other side, and then take the floss out, okay? Now, often with braces, it's easier to use a waterpik, all right? We really want you focusing on the 2 minutes of brushing every day, 2 to 3 times a day. Flossing is great on top of that, but if it's a little hard, especially if you're younger parents, it's a good idea maybe to get them a waterpik. And what we want them to do is trace along the gum line and in between the teeth. All right, all along the gum line and in between the teeth. And then the same thing on the backside to really dislodge. You wanna do the flossing or the waterpik before you brush, all right? So the brushing should come after. The flossing is gonna loosen everything. The brushing is now gonna get everything fully off the teeth before you rinse. All right, so you're done with your flossing, you're done with your brushing. Now what we're gonna move into is a fluoride rinse, okay? So these are just 2 samples of a typical type of fluoride rinse that we recommend. It doesn't matter really which one you use. Any over-the-counter fluoride rinse is fine. Now, the most important thing with this is you put it in, you rinse, you swish it around your mouth for 60 seconds, then spit it out. Then no rinsing with water for at least 30 minutes. So we do recommend for children, right before bedtime, after brushing, the last thing in their mouth. Then you don't have to worry about them eating or drinking too soon. But at least 30 minutes with no water or no eating, okay? Adults, this is really to make sure you don't get cavities, all right? So really for the kids who are more at risk. It'll also help prevent white spots or white lesions or what we call decalcifications. So these are things that are 100% preventable with braces if you brush well. So this is what we're trying to avoid, all right? You can see on this side, this is good proper brushing. The braces came off, the gums are healthy. They're pink, they're not red. There's no marks on the teeth. You look at this side, you can see those white areas, all right? It's an outline of where the brace was. That's basically where the plaque was not removed from around the brace with a toothbrush. It infected the gums and it caused the plaque to release acid, which eats away at the tooth structure. And now you get these white areas. You can even see they will eventually become cavities, all right? You can see this area where it actually became a hole, okay? So not brushing causes the enamel to be broken down, to be damaged with first staining, which you cannot remove. All right, no matter how hard you brush, this will not come off now. And also, those white areas are now weaker and can eventually become decay or cavities. All right, so brushing can fully prevent this, along with the rinse. If you do what you're supposed to do, your teeth will look like this when the braces come off. Okay. All right, now let's talk about foods to eat. So obviously there are certain foods you want to avoid with your braces. All right. And obviously the most important one is for us chewing gum or sticky candy. So anytime you're chewing on these sticky candies, what can happen is it will stick to the little colors that go around each brace. Or if you have clear braces, the little clear elastic that goes around the braces, those little mini elastics hold the wire in place. All right, so their purpose is not just to dress up your teeth. They're going to hold the wire in place. Without the colors, the wire pops out. So the chewing gum can pull those off. Then the wire starts to pop out and it's going to poke and bother you. The gum also can cause a brace to get loose. Okay, so you see here, this is a brace. What happens when it's loose? It's no longer detached to the tooth. Okay, it still might be on the wire, all right, but it's not actually glued or bonded to the tooth anymore. So no gum, chewy candy. You don't want to bite on anything really hard either. So chewing gum, Starburst, Tootsie Rolls, Laffy Taffy, that type of consistency, okay? Also, very hard foods, okay? So things like hard toasted bagels, hard French baguettes, you want to avoid. You don't want to bite into an apple with your front teeth. You want to cut into slices. Raw carrots, not a great idea unless they're sliced really thin, okay? Or cooked. So you get the idea. Soft foods, not hard foods. If they're harder foods, have them in small pieces. Okay. Now, sometimes something will bother you with the braces and you can't quite get in right away, all right, or you're not due for an appointment, and this is what we have this wax for. So wax is basically what we said it is. It's just wax. It's soft wax, okay? And what we use this for is just to act as a cushion over something that's bothering you. So when you first get your braces, maybe this little hook's bothering you. This is normal to have in there, but it might irritate your lip or cheek the first few days, all right? So all you're gonna do is you take a soft piece of wax and you stick it on the offending brace. All right, now no lip or cheek is gonna get caught on there, okay? This is another common area where sometimes you have a little mini emergency in between an appointment. If you look really closely here, there's what we call a steel tie or a steel ligature. And we put this on some teeth either instead of the colors on an individual brace or underneath the color. And you see this little pigtail should be tucked underneath the wire. Sometimes it pokes out, all right? And it gets moved by your toothbrush once in a while or something gets caught. So also, you can use wax on there like we showed before. I won't take that off, but the best thing to do is you take the eraser end of a pencil or even your fingernail, and it's soft. You can just kind of tuck it right in, and now it's not going to grab anymore. All right. So that's one of the best ways to kind of get yourself out of trouble. So those are the two most common things. Something pokes you, something got bent out of shape, you tuck it back in. Other things, you can always give us a call, let us know. If a brace becomes loose like this, please call or email or let us know. It's not always necessary to come in right away. We will let you know what to do or if we need to move up your appointment. Okay. So now after you get your braces, okay, you're going to notice that later that day, maybe about 5-6 hours later, your teeth start to get sore. All right. And it's kind of like an ache. I describe it as kind of thinking of a headache, but in your teeth, children. Okay. And this will typically last anywhere from 2 to 3 days. It can last up to a week, especially for adults. It tends to last a little bit longer in adults. Okay. Motrin or Advil tends to work better than Tylenol because of the anti-inflammatory effect that ibuprofen, which is found in Motrin or Advil, will have. So you can give it every 6 hours. The same dose you would give your child for a fever or aches and pains is what you can use. Adults, same thing. You can take an adult dose every 6 hours. So that pretty much summarizes how we deal with braces and first getting braces, keeping them clean, making sure they don't break, all right, and dealing just the minor discomfort that'll last the first few days. The only thing I want to add is for adults, you may not have to use the Fluoride rinse we talked about before, unless you're at risk for cavities, which your dentist would have told you or we will tell you. Listerine is a great thing to use every night for 30 seconds to a minute after you brush. That really is more for gum health. And for adults, we're not so much worried about cavities if they're brushing well. We're worried more about gum health to make sure that your gums stay healthy. So good luck. Congratulations on starting your journey with your braces. And we will see you back in the office next time.